Okay, my name is Terry Rudd. I'm going to demonstrate how you give mixed insulin in one syringe. And I'm going to go ahead and demonstrate rapid-acting insulin, which is regular insulin, and intermediate-acting insulin, which is considered NPH. If you look up here, your rapid-acting regular insulin is the only insulin that can be given IV. All the other insulins can be given sub-Q, and it's the insulin we give in an emergency. So you want to protect this vial. You don't want to contaminate this vial, which happens to be clear. The NPH insulin is intermediate acting, and all insulins can be given subcutaneous. So oftentimes what happens is we give both insulins together, usually in the morning, and prior to giving insulin, what are you going to check? Blood sugar. And what would you consider a normal range for blood sugar? It varies a little bit from lab to lab, but around 65 to 100. They've lowered the threshold a little bit. Some labs will take it to 110. So, if the blood sugar is 140, do you think you would give your insulin? Yes. Yes. If the blood sugar is 60, would you give your insulin? No, because what does insulin do? It lowers the blood sugar. So let's just say we have an order to give regular insulin 10 units, and you always spell out the word units. You never put the U because it might be misconstrued for a 0. And we're going to give NPH 15 units, and that's going to be at 7:30 a.m. That's a common order, correct? Yeah. Okay. So you go and get your insulin from wherever you get it in your facility. The regular is clear and the NPH is cloudy, although that's not the rationale for protecting the regular. The clear cloudy is not the rationale. The rationale is you never want to contaminate your regular because it's your emergency IV insulin. Does that help? You then are going to check your bottles and make sure your bottle and your syringe says U100 or that they match. 99% of the time you're going to have a U100 bottle and you're going to have a U100 syringe. And this syringe is a 1 milliliter 29 gauge half-inch U100 insulin. Because if you're using other insulins like U40, you have a U40 insulin, U40 syringe, okay? And that means, this means there's 100 units per 1 milliliter. I'm of course going to wash my hands, right? Of course going to wash my hands. Then I'm going to put gloves on. I'm going to explain the procedure to the patient. And where may you inject the insulin? Fatty tissue. There's so many places. Commonly, abdomen, arm, it can be thigh, it can be back. It can be back. So then what I'm going to do is I'm going to make sure my insulins aren't expired. And if an insulin has been opened, it should have a date and time. Most facilities have a policy like 20 days or something like that. I'm not going to quote it exactly because I don't remember. Now, if you just want to make it easy, go ahead and clean both bottles, correct? Which one do I not contaminate? Clear. The clear. I'm going to gently rotate the NPH. I'm going to gently rotate it to mix it up. And then because I don't want to contaminate the regular, that's what I'm going to draw up first. Excuse me. So I go ahead and inject air into my NPH. How much? 15. 15 of air into my NPH, correct? There's my air. So far so good? Yes. And now how much air into the regular? 10 units of air into the regular. And I'm going to tell you at this point I'm not ready to give this. Why not? You have to have 2 licensed people verify, correct?
Yes.
So I need to have somebody with me who's checked the blood sugar. I'm going to tell you the blood sugar was 140. I'm going to have a second person with me looking at the order, and they're going to watch me draw it up. Got it? So, what do I draw up first? Regular. I've already injected my air, correct? So what's going to come back into my syringe? 10 units. Now, I like to do my first one. I like to go down a little, make sure I have no air bubbles. You with me? Flick out my air bubbles. And then I'm going to come up exactly to 10. On this syringe, this thing will turn around so you can see. So I'm going to come up to 10. I'm going to have a second licensed person check with me, double check, right? No bubbles. I'm going to pull this out. Now, what do I have to do? I have to pull back exactly to 25. Because I already have 10, correct? So I'm going to pull back exactly to 25 with the person with me double checking. I don't get to mess with air bubbles. I don't get to flick anything back into the bottle. I have to come exactly to 25. We both check it. And now I go to the patient. What do I do when I go to the patient? I better check their ID, right? Armband if they have it. If not, if you're in a facility, often a psych facility, you're going to check photo ID with the chart, correct? Or have them say, tell me your name. And I will, date of birth is helpful, and I often have another, as a student, I often have another staff member verify for me also, that this is that person, right? So I'm going to check their ID, make sure I have the right patient, the right time, the right drug, the right dose, right? The right blood sugar, correct? And then I'm going to clean the skin. How do I clean it? Inside out. You can pinch it a little if you want. I'm going to go in at what angle? Well, the needle's short enough. You can go 90. Okay, I'm going to go 90. In general, we don't aspirate on a sub-Q. If I'm worried about the patient having pain, I'm going to have them take some breaths in and out. I'm slowly going to inject in. Yes?
Yes.
I'm going to pull out. And then I'm going to lock my needle. And this is going to go directly into a sharps container. If you were giving heparin sub-Q, you would not rub the site. You can, if you want, gently do so with the insulin, but it's not absolutely necessary. Okay? And then I take my gloves off. And then now I want to make sure my patient eats breakfast. Because the regular insulin will peak around 10 o'clock. The NPH insulin will peak around 4 p.m. And that's why we give diabetics a 10 o'clock snack and a 4 p.m. snack. Thank you.